Hi, my name is Ben Crawley. I'm a solutions consultant at Appian, and I'm going to present a short demo of the Share My Care resident and patient MDT workflow tracker that was built for Bexley Health. What you can see here is a dashboard for an administrator or a user of this application, and there are different dashboards for different personas, including the caregivers, a triage team, care team, for example, and different options will be present when they log in. In this example, what we want to do is kick off a process to do the patient entry into the hospital or care facility. In this case, I want to provide some details. Now here we have a guided wizard, and this allows us to track the information that we need to collect, integrate to other systems to pull information back, but also to ensure that we enforce validations to make sure that our data quality is okay. So here I'm just going to put in a patient and the date of birth. So for example, if we go a date in the future, we have a validation that kicks in, and also the NHS number. Hit continue. Here I can provide the emergency contact details. In this case, I don't. These fields aren't mandatory, so I'm not going to provide these details for the demo. And here I can add the discharge or admission details depending which way we're going. So what is the date that we're going to admit? And that's defaulted on today's date. If the patient is homeless, then I can select this and it removes their addresses, but also I can put in the address details here. So I can provide that information. And to save rekeying, we can copy that across to the discharge address as well. I can also indicate which home or GP that this patient is assigned to pre and post admission. We can continue with the form, and here we're going to ask some details around their COVID status. So have they been tested? If they have, then we drive the rules to determine, well, what is the test result, positive, negative. If they haven't been tested, then we ask, do they have symptoms? If they have symptoms, then we ask, what are the symptoms that they are showing? So we can collect that information. We also ask to upload any of the discharge or admission forms that need to be added to this particular submission. Once we've done that, we can upload or submit the form. That's going to create a new record for our patient. So here we've got the success indication, and by doing that I can click on this link that takes us directly to that patient's record. So here's the landing page for that record. I can see the details that we've added in. We can see some high-level stats in terms of their COVID status, NHS number and pathway, and also the care that they need to have. And that will come once we start to progress through the process. And on the left here, you can see exactly where we are inside of that process. So currently, we're sitting at triage since we've entered in the patient information. If I click on my task tab here, we can see that we have a task waiting at the triage team as they need to perform the triage for this particular patient or resident. So I can move to my triage team view. I'm currently logged as someone in the triage team, and they're going to go to their task tab, and they'll be able to see that there's a task here for Mary Citizen that's waiting for the triage team. They can pick that up and they can see details of Mary. There's a link here to Mary's record if they want further details. They can confirm the address information with Mary, but also too, they need to determine the pathway that this patient's going on. So in this case, we're going to say that this patient's on pathway 1. We can drive more fields as well. So in this case, the care setting is going to be home care. And we may need a GP follow-up. We can also upload the CMC plan as well if we need to. And in determining our triage, we're going to work out what assessments are needed. So in this case, we can have 2 assessments, social care and community care. And if that's the case, if both selected, the workflow will go down both those routes. In this case, for the demo, I'm going to select social care that we need, but we do not need community care. Once I hit submit, that task is complete. I'm now going to move back to my screen, my logon, because I'm also part of the social care team. So if I go to the task tab, You can see that a task is now being allocated to the social care team. That's because we selected social care that was needed. So someone from that team can pick that up. And here they can do the assessment. So once the assessment's completed, they can provide the assessment result and upload that document. They can determine the type of care needed. So in this case, I'm going to select complex. And then we have a number of questions here as mandated by the Care Act that we need to ask. So, for example, does this patient or resident have difficulty eating, drinking? If they are able to do that, then there's no impact on their well-being. Are they able to go to the toilet, for example? If they're not able to, then that's going to have some significant impact. So we can provide these questions as part of that assessment. So for the demo, I'm just going to go through and select all the answers so we can progress this on. These ones are quite static, but you do have the option to make them a little bit more dynamic, a little bit more smart, depending on options that are selected. They can drive the behaviours of other fields as well. So once I've completed my assessment, I can hit submit. And we're going to get one more task for the social care team to input this social care plan. So we can open that up. We can say whether or not further care is needed. We can upload that care plan if we need to. But we can also provide a caregiver here to deliver the care or to do any check-ins. So in this case, I'm going to assign Sonia to this. And the first check-in date is going to be tomorrow, for example. So when we submit that, because we've selected Sonia, Sonia is a caregiver, and if she goes onto her mobile device, she has access to the application on her mobile, and she may be giving a check-in to the particular patient. She can go to her task list, and she can see that she's got a task here for Mary. So while she's visiting Mary, she can open the task on her mobile. She has access to Mary's record here, so she can click in and see all the details of Mary's record on her phone, and can she do this while visiting. And while she's with Mary, she can also provide the check-in. So she can provide some comments here to say, and use features from the phone such as dictation. So instead of typing, she could talk to the phone. I'm with Mary right now, and she seems to be okay. So she's provided her comments. She can schedule another check-in if she wishes. If she does not want to, she can end the care. And the reason here is because Mary is fine. No care is required after this. So she can complete her task on the mobile. And then if I go back to the patient record for Mary, we can open that record up. We can see now that the care is completed. So we've done a very quick life cycle of the care process. We can see under tasks that there's no more tasks open, but we also have a completed list of tasks, and this is capturing the audit trail around who did what and when. We also can see there's a dashboard here for the social care, so we've collected the details on the assessment, the questions and answers to the Care Act questions. We can see details of the care plan that was uploaded, but also to any check-ins that were provided. So in this case, we can see the details on the check-in that Sonia did, and the comments that were captured on her mobile device. Just to finish off the demo, some of the features that were added here were the ability to do a facility check-in. So for example, at the different care homes or different GP practice, for example, a facility manager come in and check in the particular facility. So currently we might be operating at low pressure, but we have an influx of residents, so we are now extreme pressure, maybe we have to be closed. We can update our staffing levels. We can also update our PPE supply levels as well to keep track of those numbers. We can also do a employee check-in as well. So each day employees can come and check in. They can indicate whether or not they're being tested for COVID, if they're ill, whether or not they need support. So if that's the case, we can trigger a help request and manage that within the platform itself. So employees can check in. And then once we've got all this information, that rolls up into a number of reports. So here we can see the level of the different homes or GP practices within the area, what pressure that they're currently running at. We can also see our staffing across the Federation, but also to at a level down to a particular a home, for example. And this is where we can see the number of employees that we have employed, their role, whether or not they're working, but also to if they have been tested or have been infected with COVID. We also can see the daily check-ins from our staff, so who's checked in and who hasn't and why they haven't, but also too we can start to round up some of the information on the suppliers to see who within the Federation has enough supplies, who hasn't, and the numbers that they have to give a holistic view. So I hope you enjoyed the quick demo of the Share My Care resident and patient MDT workflow tracker, and have a great day.